Hello, this is Dr. Yannis Alexandrides. Today I will be talking to you about frequently asked questions about rhinoplasty. A lot of my patients ask me what's the difference between a rhinoplasty and a septorhinoplasty. A rhinoplasty is the operation of changing the shape of the nose for aesthetic reasons. A septorhinoplasty is an operation where the septum is also altered, usually for people who have a problem breathing. It can also be necessary for aesthetic purposes, especially in cases where the nose is crooked to the one side. Is a rhinoplasty done under local or general anesthesia? Well, it can be done under both. Usually, a proper rhinoplasty, which involves osteotomies or breaking the bone, will involve general anesthesia for safety and comfort. However, tip operations, where bone is not involved, frequently can be done easily under local anesthetic. How long will I need to take off work? I usually advise my patients for a proper septorhinoplasty or rhinoplasty to take 2 weeks off work.
Okay.
How long will the splint stay? Usually the splint needs to stay 7 days. Can I fly after surgery? I would advise my patients not to fly for 2 to 4 weeks, depending on the severity of the operation and how much time was needed for the operation itself. Does a rhinoplasty require an overnight stay? The answer is yes, and that's because we need to pack the nose with some material to stop the bleeding. This material needs to stay usually for 24 hours, which is the time where a bleed can take place, so it's more appropriate for the patient to remain in the hospital for the first 24 hours. Hurt? Usually an operation of the nose is not as painful as people think. There are new techniques that minimize trauma to the face, and usually it's not a very painful operation. Will I be bruised or swollen after a rhinoplasty? Of course, there will be some bruising and some swelling. That differs a lot from person to person and also depends on the type of rhinoplasty and the extent of the rhinoplasty. I would say, on average, 2 weeks are necessary for the bruising and the swelling to go down. Okay, ready? When can I go back to exercising? For full-time exercise, I would give 6 weeks after a rhinoplasty, so the swelling, the bruising, and also the healing of the bone have been resolved. However, mild forms of exercise might be allowed a little sooner if the doctors allow you. When will I see the final results? Again, like anything else in medicine, final results can differ from person to person and from the type of operation to the type of operation. Usually people with thicker skin take longer time to see the final results. On average, 1 year is necessary for the final results.